Welcome to This is USG, a video podcast presented by the universities at Shady Grove. 9 universities, 1 campus, and great results. I'm Ann Schneiderman, Executive Director of USG. The health and human services industries play a critical role in our regional economy and in the world today. In today's episode, we will focus on the University of Maryland Baltimore programs at USG. These podcasts are a way to share the great opportunities, the innovation, and the programming at USG, and for me to learn more as well. Today, I have 4 fantastic guests who are going to share with us more insight about the programs at the University of Maryland Baltimore that are offered here at USG. Our guests include Dr. Becky Wiseman, Chair of UMB's School of Nursing at USG, Dr. Joan Pittman, Director of UMB's Master of Social Work program at USG, Dr. Heather Congdon, Assistant Dean for UMB School of Pharmacy, USG campus, and MaryAnn Schneiderman, UMB's School of Dentistry. Hello, everybody, and welcome.
Hi.
Hi, nice to see you all. I'm going to ask each of you to talk a little bit about your role and a little bit about your programs. Give the audience some background on who you are. Becky, why don't we start with you?
Of course, start with me. We're the School of Nursing. We've been at Shady Grove from the very beginning. We've been there for 20 years. And we have the undergraduate program. Currently, we're admitting 76 students per semester. We will be increasing our enrollments up to 100 per semester by 2022. And we also offer an FNP, DNP program, and all of these programs are residential, which means all of the program is presented at Shady Grove. There's no need to go to the home campus for any of the coursework.
Fantastic. Thanks, Becky. Heather, why don't you tell us a little bit about your program?
Sure. So actually, the University of Maryland School of Pharmacy is the 4th oldest pharmacy school in the nation. I'm not sure if you guys knew that. But we began offering our PharmD program, which is our Doctor of Pharmacy program at USG in 2007. So in the Doctor of Pharmacy program, we train pharmacists to promote appropriate, effective, and safe medication use by patients. Working on the healthcare team, pharmacists are able to closely monitor their patient drug therapy and make recommendations on the selection of the best medication for a patient's condition with the correct dose and duration of therapy. We have graduates in a wide variety of settings like community pharmacies, hospital pharmacies, but then more kind of not as usual places as well, such as pharmaceutical industry, academia, and FDA, as well as others. We have 2 brand new programs at the universities at Shady Grove that just started last fall. One is the Masters of Science in Medical Cannabis Science and Therapeutics, and one is the Masters of Science in Pharmaceutical Sciences. So for the Masters of Science in Medical Cannabis Science and Therapeutics, we have many different academic and professional backgrounds. But what we're hoping our graduates are able to do is become trailblazers in creating new positions in the medical cannabis field, including clinical practice, research and development, regulatory affairs, and patient advocacy. We hope our graduates are equipped to educate patients, healthcare providers, policymakers, and public on the science and clinical use of medical cannabis. And then the Masters of Science in Pharmaceutical Sciences, we have students who are interested in working in research in pharmaceutical industry, government, or academia, but don't have experience in bench research. This program is 16 months long, with first years taking primarily courses in pharmaceutical sciences and doing skills labs, and then followed by a 6-month pharmaceutical biopharmaceutical internship experience. And that takes place at places local to Shady Grove, including pharmaceutical companies like AstraZeneca, government labs like NIST, and academic labs like IBBR next door, and the University of Maryland School of Pharmacy in Baltimore.
That's great, Heather. Thank you. I'm going to hang on to that word trailblazer. We'll come back to that a little bit later on. So Joan, why don't you tell us about the School of Social Work here at USG?
Thank you, Ann. So University of Maryland School of Social Work does offer the Masters of Social Work degree at the Universities of Shady Grove in several different specializations in clinical behavioral health and clinical children and families. So the School of Social Work, like nursing and pharmacy, has been at USG for pretty much as long as USG has been around, However, about 5 years ago, we decided to offer the complete MSW program at the University of Shady Grove. And really that was because of student interest and also community interest. So nonprofits and government agencies in the Montgomery County area were really telling us they need more licensed master's level social workers to meet the needs of the community. So that's why we expanded our program, and we're continuing to grow our program at Shady Grove. So what do social workers do in Montgomery County? Lots of different things. Social workers work in lots of different settings, from schools to outpatient counseling centers, hospitals, prisons, social services, crisis services, and really work across the lifespan. So social workers in our program are trained to provide mental health services and substance use services for children, adolescents, adults, and older adults. We do that with a variety of different modalities and different techniques. One of the really critical parts of our educational program is what we call a field placement, similar to an internship. And so what we do to train social workers is we offer coursework, a traditional coursework, but then we also, as part of the degree program, students work in agencies or government institutions in the community to learn those skills under the supervision of a skilled social worker in those agencies. So our community partners are really critical in training social workers, and it's a great partnership that we have.
That's great. So the big takeaway for me is the responsiveness of your program to community demands and community needs, and the embedding in the program. I hear that from all of you as well. So I think those are really interesting and important aspects of these programs. MaryAnn, why don't you share with us some great information about the new program in particular here at Shady Grove in the new BSE building.
Thanks, Ann. Well, we're definitely the newcomer to USG. The entry-level dental hygiene Bachelor of Science program has been at Baltimore campus since the early 1970s. This dual degree track is a BS-MS program as a clinical dental hygiene leader, where upon graduation, our students will receive both a Bachelor of Science and a Master's of Science in dental hygiene, specifically as the clinical dental hygiene leader. We started our program in June of 2020 at Shady Grove, with the master's courses all being online, and our students now are at Shady Grove taking their preclinical courses in laboratory and in the clinic. So the need developed because dental hygienists historically have been in clinical positions, and what we found was that there is a need for dental hygienists with advanced degrees and a skill set in order to triage oral health issues in hospital emergency departments, in physicians' offices, other types of healthcare settings, and in serving the communities that are underserved for patients who don't have access to traditional dental practice treatment services. So our new program will allow our hygienists to graduate with the full clinical skill set as a hygienist, and it will project them into positions of leadership in the community and in various health settings. So we're very excited about it.
Yeah, I actually had a chance to pop over
Yes.
last week to see some of the students in action, and can't wait to see that whole center hopping with patients and with students as well. It will happen soon, I'm sure. So, so I'm hearing, MaryAnn, again, from all of you, I'm hearing leadership, I'm hearing trailblazer, I'm hearing embedded in the community, responding. Becky, the nursing program is one of the most established programs here, and in fact, building one where the nursing program is located is going to be completely renovated and expanded for the program. Can you talk a little bit about the success of the nursing program here, and what is it about Montgomery County that's important to be located here? We have a lot of very diverse students who come to Shady Grove. I think more than 50% of our students are first generation or underrepresented students. So there's a lot of diversity here. Talk a little bit about the success of the nursing program in this particular setting here. What is that combination? What does that do for the school in particular?
The program at the nursing program in Montgomery County is successful because it's a partnership. It's a community partnership. Most of our students come to us from Montgomery College. They take their prerequisites. Many of our students, or most of our students, are residents of Montgomery County. So as they learn to become nurses, they are in the hospitals, in the clinics, in the healthcare settings within the county and within the region, because we do go into the district. But these students are working with their neighbors. They're working in their community. They are going to, when they graduate, they're going to go into their community and work. Many of our students stay. Very few of our students leave unless they're military or some other branch like the public health service, but most of our students stay. All of our hospitals are committed to having our students. They welcome us, and we're embedded. I mean, there are so many things we do in the community, and I'd like to say with the rest of my partners here on this podcast, we all work together. We work together in interprofessional opportunities, and we think we make a contribution to the healthcare of this county, of Montgomery County, and to the region. So
Yeah.
hopefully that answered some of your question.
Oh yeah, absolutely. So all these words are standing out for me. Partnership's the other one. That's fantastic. And collaboration as well.
Mm-hmm.
Joan, let me ask you the same kind of question. You talked a lot about how the social work program was really responding to demand and priority. Talk about the importance of being here in Montgomery County for your programs.
Well, I think it's really critical. As I already said, I mean, that was really the impetus for our expansion here, is students really demanding, wanting to work in Montgomery County and the region. As Becky said, we also have students who are in DC and the surrounding counties, but students really wanting to stay in this community, work in this community, contribute in this community, and our partners are the nonprofits. Montgomery County has really some of the national leaders in substance use and mental health services. And so those are great partners for us. And there's such great training opportunities in the county. So it's really critical for us to have a program in Montgomery County. And we're continuing to see a lot of growth, interest in our program. And obviously with COVID, there's tremendous need. I'll just give one example of that synergy of our partnership. One of our community partners is EveryMind. That organization provides a lot of mental health and well-being services in Montgomery County. Well, they are seeing an increase in crisis calls and need for crisis services, and they've obtained some additional funding to provide those services, but they really didn't have enough people, practitioners, to provide the services. So we partnered with them in training some of our students to be able to work on the hotline, and that's obviously fantastic training for them, and to have that supervision. And so those kinds of partnerships, we're filling a need, and we have those great partnerships with different agencies.
Fantastic. That's great. Heather, talk a little bit about Montgomery County and your programs as well. I think partnerships probably comes up again for you as well. It sounds like, especially in the research side of things. But you also use the word trailblazers. Is there something about being in Montgomery County that facilitates that kind of approach, or is that just the uniqueness of the program?
So I think for the cannabis program, part of the trailblazer part is just the uniqueness of the program, because it's brand new. It was actually the first of its kind in the country, which is really cool. I think for the location, we're in the I-270 Life Science and Biotechnology corridor. So for any degree in the School of Pharmacy, that's going to be helpful. This has afforded us the opportunity to have strategic partnerships for our students, such as places like the FDA, the NIH, pharmaceutical industries. I know we have a really strong collaboration with AstraZeneca, which used to be MedImmune. These are just to name a few. One of the other really cool things I think about our program, especially for the Doctor of Pharmacy, that's kind of been in place for a little bit longer, since 2007, is it's almost created its own version of a pipeline. So we have several students that were in our program that went through the Montgomery County Public School System, and then went to Montgomery College to do their prerequisites. And in some cases came straight to pharmacy school after that at the universities at Shady Grove, or they even completed an undergraduate degree. We have several students that completed the biology degree, which is through the University of Maryland College Park at the universities at Shady Grove, and then went on to complete their Doctor of Pharmacy degree. So that's been really cool for the students that live in Montgomery County to be able to stay in Montgomery County and then work in Montgomery County upon graduation.
Fantastic. That's great. MaryAnn, what about the School of Dentistry? What do you see as some of the unique opportunities that being based here in Montgomery County at USG?
Well, I think that we have been somewhat limited just with being only in Baltimore, and this will give us new opportunities to partner with the various schools that are located at and programs that are at USG, along with the hospital and the state-of-the-art facility that we have now with the dental pre-clinic and the dental clinic will give our community access to dental care that they haven't had except for going to Baltimore in the dental school. So we're looking to expand the opportunities. Of course, COVID has put a bit of a damper on things and moving forward, but as restrictions are being lifted, I see our students getting out into the community more, partnering with Montgomery Health Centers, dental departments. And I think it's limitless for these students, the opportunities that could be available to them in Montgomery County.
That's great. That's great. So Becky, you raised the point about collaboration, and just thinking about the description of the dental hygienist leadership program, MaryAnn, that you shared, that as the emphasis on leadership suggests being able to move into multiple fields, multiple areas, to kind of use your skill sets in different capacities. And, that suggests the need for collaboration. That suggests the need
Absolutely.
to really work across different disciplines. Becky, could you talk a little bit about how you all collaborate? And then I'd like to hear from all of you too about, where are the points of collaboration, and how does that advantage our students to really be trailblazers and to be innovators and leaders in their fields?
So one of the first things I want to talk about is the opportunities we'll have with the dental program. When the new building, the BSC building, was put in place, we put in space for an IPE, interprofessional education clinic. And one of the things that we're looking at is the understanding that a person is more than one thing. We have to look at the whole person. And so to separate dental from the rest of the medical care is inappropriate. We need to put the two together. So it's very important that nursing, our students learn about oral hygiene and oral care. And it's important that we understand that when a person sits in a dental chair, they bring other problems, other healthcare problems to that chair. They may be diabetic. They may have lung heart problems. And so there's a lot of opportunity for us to work together. We may spot a need for the dental, and the dental may spot a need for nursing and other disciplines to be involved. So we're really excited about that opportunity to partner, and we're looking forward to growing that as we get back on campus, I hope, soon.
Yeah.
Other areas that we work together, we've worked with pharmacy, we worked with social work in various places. We've worked in clinics together. And I'm going to kind of let Joan and Heather talk about some of the exciting work at Mercy Clinic that they've been doing, because that's awesome. And we're recognized across the country for our work with IPE, with multiple presentations at national and international conferences where we've highlighted the work. And oh, by the way, our patient outcomes are amazing. And it really speaks well to what's going on in our clinic. So I'll let Joan and Heather kind of talk about it because they've been more involved on the day-to-day aspects of it.
Thanks, Becky. Joan or Heather, which one would you like to go first?
Heather, you want to start?
I'll talk a little bit about the collaboration. So first, at the universities at Shady Grove, to piggyback on what Becky was mentioning, I am beyond excited about the BSc and the location of the interprofessional clinic that's on the same floor as the dental services. As Becky mentioned, this just affords a wealth of opportunities for students from all the disciplines that we have at the universities at Shady Grove that are related to healthcare. As one of the co-directors for the Center for Interprofessional Education at the University of Maryland, Baltimore, I'm really excited to form collaborative partnerships with local healthcare entities in order to provide both meaningful interprofessional opportunities for our students, but at the same time, while providing enhanced patient care for the most complex and vulnerable patients in this area. And one of the things that Becky mentioned was some of the collaborative partnerships that we already have in place in Montgomery County. She mentioned Mercy Clinic, which is really where we got our start, probably about 5 or 6 years ago. But most notably, we've been working with 2 of the outpatient ambulatory clinic sites affiliated with Holy Cross Hospital. And through this partnership, we've had students from the Doctor of Nurse Practitioner program through UMB. We've had social work through the UMB social work program. We've had Doctor of Pharmacy students. We've also recently partnered with University of Maryland College Park as well, and we have nutrition dietetic students from theirs as well participating in these clinics. And we're focusing on patients with uncontrolled diabetes and a suspected or documented psychosocial condition like anxiety or depression. And we actually received funding from the National Center for Interprofessional Practice and Education to expand to these 2 clinical sites. And as a result, have been able to demonstrate and document significant improvement in clinical findings for our patients, not only with their diabetes, but with other parameters as well. We've significantly improved hemoglobin A1C values, which is a marker of diabetes control, by over 2 percentage points, not 2%, but 2 percentage points, as well as decreased emergency room visits as well. And as Becky mentioned, we've presented this information on our clinics across this country and across the world. We've been to New Zealand, we've been to Canada, we've been to Great Britain. We've been all over the place before COVID, of course, to present these findings. And most recently, we've won the George E. Thibault 2020 Nexus Award, which is a national award from the National Center for Interprofessional Practice and Education for innovative clinical collaborations in interprofessional education and practice, which was super exciting to find out. We just found out about a month ago. So
Wow.
Lots of wonderful things going on, and I am so excited to continue those collaborations in the new BSc building and take what we've been doing out in the community and bring it home to USG to continue to expand those services for our complex, vulnerable patients.
That's really exciting, and congratulations on the recognition for that great innovative work as well. Joan, you want to add to that as well?
Sure. All of this partnership and interprofessional work is really critical for social work because the field of really what used to be called mental health has really changed to this term behavioral health. And sometimes it's referred to as the 3-legged stool, which is mental health, substance use, and health. So a lot of services now, social work services and mental health services, are now being called behavioral health services, and they're being offered in health settings in a very collaborative way, because we know when a person is struggling with diabetes, for example, they may also be struggling with depression or some trauma issues or some access to services issues. So these interprofessional clinics and different collaborations are really critical for social work students to learn these skills and be trailblazers, we're going to use that word again, to be trailblazers in bringing those interprofessional competencies and behavioral health skills to the field, because that is something new that's happening in the field.
Yeah, no, that's very exciting. And exciting to think that the intersection of all these professions can happen here at USG as well. So MaryAnn, I'm going to give you a little bit of a variation on that collaboration question. Becky talked a little bit about what you all are doing as well, but how do you see dental hygiene, the field of dental hygiene changing, and how does this collaboration help our students in that context? What's happening in dental hygiene or in dentistry more generally that this collaboration really helps advantage or move forward?
Well, dental hygienists have always been focused on health promotion and disease prevention. And we really are most interested in health outcomes. And I see the role of the dental hygienist, especially our clinical dental hygiene leader, having the need to work with other professionals in order to treat the whole person and not just the oral cavity. There is a lot to a patient than what we see in the oral cavity. We consider all aspects and look closely at the rest of their medical history, and we need to have our hygienists have close proximity and access to other health professionals so that we can launch this dialogue and provide access for these patients to the services that they need, along with mental health services and pharmacy. So there's a real need for the dental health professionals to be involved within the community of other health providers. And looking at the focus going towards virtual healthcare and being able to provide teledentistry services to assess a patient's needs is just one of the things that are coming out now. As a result of COVID, also, we've been forced in dentistry and other health professions to look at alternative measures and means of assessing our patients, and looking at an option of minimally invasive care also, as opposed to the traditional route. So we're very excited about being positioned at USG and all the opportunities that may afford for our students to be able to work interprofessionally.
Yeah, MaryAnn, that's so interesting. Listening to all of you, the kind of cutting edge holistic approach that you all are taking to how you prepare students and think about healthcare overall is really exciting, and very exciting to think that it's happening here. We're just about ready to wrap up, but I wanted to see if any of you had any closing thoughts or anything else you'd like to share. You know, we are still in the midst of this pandemic, and so much has been impacted on the campuses, but across the world, all of our economies, families, both devastatingly as well as inconvenienced, and schools and all kinds of things. So I think it's probably hit the hardest in the healthcare profession, professionals on the front line, taking care of people daily. I had to go see the dentist this morning, and and everybody was so cautious and so thoughtful and so careful, but at the same time, they're at risk. They're right there on the front line. So I wonder if, as we close out, if you could share a few thoughts on the consequences of COVID for how we train our students. Maybe it's looking forward a little bit. Maybe it's thinking about what's changing. And we know there's going to be a huge demand. There's the demand for healthcare professionals is going to continue to grow. But what do you see on the horizon in this hopefully soon post-COVID world that has implications for how we prepare our students? Becky, I'll let you start with whatever reflections you'd like to share.
Well, I have a couple of thoughts. One of the things that nursing experienced, just like the other disciplines, is that back in March, our students were told they could not come to the clinical setting because of the pandemic, which we all understood. But it caused us to do what we call pivot. And I think everyone has done a pivot, where we had to look at virtual simulation and other ways of teaching skills and ways of thinking. There have been good and bad things that we've learned, just like everyone has discovered. But one of the positives, because I'm a person that makes the lemonade kind of person. So one of the things with it is that many of my faculty were reluctant to do virtual simulation over the years. And it probably takes, the research has shown, 10 to 15 years for people to embrace new ideas and new technology. And within a matter of 6 months, most of my faculty have had to embrace something that they probably wouldn't have embraced earlier. But with the pandemic, they've embraced it. And the positive is everyone is saying, wow, this stuff works. Virtual simulations and other ways of working with our students. Actually, there's many positive things that are happening, and they're actually enthusiastic. And so going forward, I see our curriculums changing. I see how we approach our teaching. We'll embrace more virtual and more other ways of looking at using simulation and using the clinical setting in a more focused way that we've done in the past. So I'm really excited about the horizons and the possibilities of what education is going to look like for nursing. And I'd like to say that our admissions has not slowed down, actually has increased. And we're seeing bumper crops of students interested in nursing. We hope that carries forward as time rolls forward. But right now, we're not having any difficulties filling our class for the spring or next fall. We have students that are on the waiting list. So that's a positive thing, because we know healthcare workers are going to be needed in larger numbers as we move forward. And to know that people are stepping up because they've seen the need and they want to be part of filling the need. So that's positive. It makes you feel good about your profession.
Yeah. Well, to use your metaphor, that's a great glass of lemonade. That's terrific. Heather, what about you?
So, Becky talked a little bit about the educational side, and I think on the other side, on the clinical side, we've been able to do some really neat things with telehealth, with both I practice uniprofessionally as a pharmacist at Mercy Health Clinic, which was mentioned earlier, and do medication therapy management. But also as well, if you think about COVID, we don't want people in large groups, congregating. And by nature of interprofessional collaboration, there's a lot of people together in the same room seeing a patient. So if we have a pharmacy student, a nursing student, social work student, a nutrition student, a faculty member, and a patient, you have at least 6 people that would all be in the same room. And so we actually, again, received some grant funding from our center, our UMB Center for Interprofessional Education, to switch our interprofessional clinics that are affiliated with Holy Cross to a telehealth model. And so we're currently in the first semester of doing that. And well, although, there's bumps in the roads and there's kinks and we had to plan extensively for that, we're still able to provide care to our patients. We do the Brady Bunch WebEx like we are here. The patients on there as well, we can see inside their home through this method a lot of times, which brings us information that we wouldn't have had otherwise. All of our students are safe in their own homes. And so it's worked. And so I think even, if we get to post-COVID, if that happens, I think there's still a place for virtual, office visits or telehealth models. Especially for those where it can be done, where visits are largely educational in nature and gathering history in nature, those things that are done with students, with chronic conditions and chronic disease, there is a place, I think, for this type of delivery of care. And so I think that is something that's changing a little bit, and that I think that even after COVID, we'll still have some level of virtual telehealth.
That's great. Thanks, Heather. Joan, what about you?
Well, I think everyone by now is aware of the impact of COVID on mental health, and that it is really having a devastating effect, and we'll be dealing with the mental health and substance use impact of this for a long time. Another thing that we have been talking about is really we're dealing with a dual pandemic, the pandemic of systemic racism and the pandemic of COVID. And because as social workers, one of our main values is social justice and racial justice. That's something that we're really talking about a lot because we, as social workers, often work with clients who are minority clients who might be victims of police brutality or other forms of racism in the community, and also are, in an unequal way dealing with the impact of COVID and those health impacts. So we have a heavy lift in the mental health field. And as Becky said, our enrollment has been pretty strong too, which is great because we need people that want to do this work, because you really can make a tremendous difference in learning the skills, understanding the impact of systemic racism on people's lives, understanding the impact of trauma, and understanding the techniques to move towards healing of both of those pandemics. So I think the other thing I would say, a lot of developments on telebehavioral health. We have grown tremendously. I mean, times of crisis are also a time of growth, and we really have grown tremendously. I mean, we have developed skills in telebehavioral health at such a fast rate, and I do think some of those skills and some of those techniques will continue even after COVID, because we can reach more people, we can reach people in between sessions, those types of things that I think there'll be a lot of research on, and it'll be really interesting to see the impact of that as well.
That's great. Thank you so much, Joan. MaryAnn, you have the last word.
Well, we have historically been a hands-on profession, and COVID has forced us to step outside our box and look at technology and how we can use technology for enhancing disease prevention with our patients and health promotion. And I don't think we realized how creative we could be. And a lot of that has gone into the programs that we're working with our students. They're doing a lot more creating videos for the patients and instructing them in a different way. And the same with triaging the needs of the patient. We have been forced into a new normal. And the same goes for our students and how they're working in the clinic. There is a new normal that is important for them to understand. I wanted to echo everything that Becky had said about enrollment. And one of the most interesting aspects we've found is that our director of recruitment and admissions has found the virtual information sessions that she holds. They're advertised on USG's news and events tabs on the homepage, and it's been a dramatic increase in the number of people who have attended these sessions virtually. She has 31 people signed up for the next session, which is on Wednesday evening at 7 o'clock. And it's really been, in a way, that push that we've needed to go into the 21st century even more and use technology to our advantage.
Well, thank you all so much for sharing about your programs, sharing your vision, sharing your insights as well. Certainly nursing and pharmacy and social work and dentistry, all those schools are very fortunate to have your talents and your leadership. And we're very fortunate to have your programs and all of you here at Shady Grove as well. So thank you for your time today, and I hope to talk with you all again soon. Take care.
Thank you.
Thank you.
Thank you.